We have a phrase at Ben Taub, always here, always ready. We live by that motto. It's all about, number one, the right place. Number two is getting there in the right amount of time. Next, it's all about the right amount of resources.
I was riding my bike on Good Friday, on Passover, and my 32nd anniversary in 2022, and a lady hit and ran me. And I ended up suffering traumatic brain injury and a lot of other things. I don't remember a thing.
It turns out that Alan was charted at Ben Taub at 4:40. Okay, he left our house about 3:30-ish, 3:45. Charted into the hospital. 6 minutes later was a neurosurgery. So you talk about not wasting a moment of time and for doing things right. So he was in such capable care.
I always had great respect for Ben Taub and some of the other hospitals here in Houston. And I think that I will spend my time, like I am today, telling people how great it is to have these resources for us.
So the accident happened August 23rd of 2022. I was actually on my way home from a emergency call because I'm a plumber, and I was out helping out a friend. He had a leak. And so I was on my way back home, and I see headlights coming from my rear view very fast. They took Post Oak exit, swing across, barely tapped my car enough so my car can, lose control. But then I just remember the first, my vehicle elevating off the ground. After that, I don't remember anything. I guess it was my femur, my hip. There's 16 screws, I think I counted on the x-ray. Another 18 below the knee with plates and stuff like that. On my head, it was gashed right here. I don't know if you can possibly see. It was gashed. And then on the side of my head, I was in Ben Taub for 28 days. But luckily, it started just getting better, developing over time. I'm just real thankful that, they took care of me at Ben Taub as well.
So at LBJ and Ben Taub, the thing that makes them so special and the thing that it takes to be a trauma hospital is you have to have everything available. You have to have all the teams that are able to show up when the patient shows up and to be able to help that patient in that exact moment. We don't get a lot of heads up at LBJ. In fact, the vast majority of the time with a trauma patient, it's minutes to seconds for us to prepare. And that's, kind of hard to imagine for a lot of people.
So the day of my accident, I just woke up. I was actually on my way out to go get him lunch and to get lunch for me and the kids. Everything was fine, just a normal day. I was passing a light, regular green light, and that's pretty much all I remember.
Well, I found out about it. I was at work, and she actually called me, but she don't remember that. So I went, and her car was on the other side of the street. When I got to the side, the other driver's truck was totaled. Her car was totaled from the front, and she was thrown pretty far. The car was thrown. So it was a pretty bad accident.
I am forever grateful for LBJ's trauma team. My ICU nurse, she was amazing. When I actually started to remember, I remember waking up and I had an art line and telemetry, 2 IVs, blood transfusion. Me being a nurse, I knew what was going on, and she calmed me down. I kind of lost it. Then I knew it wasn't good. And I'll never forget, because she did tell me, she was like, I need you to fight. I see some fight in you.
To take care of trauma patients, it's truly a group effort. When we acutely respond to a trauma, it's a team of surgeons, emergency medicine physicians, nurses, respiratory therapists, anesthesiologists, radiology technicians, and really, it's almost everybody in the hospital coming together to be there for these patients.
2019, I started to do music. It evolved really quickly. A lot of people enjoyed my music and enjoyed my messages throughout my music. So I love it. I was at a video shoot. I was recording a song and a drive-by happened, and I got hit in the head and in the arm. And that's how everything happened. I think I was in a coma for 3 days. When I woke up, they were washing me and cleaning me and helping me get myself together. I was in the hospital for 3 months, but I was at Ben Taub for 2 weeks and here the rest of the time. Different doctor for every part of my brain, like what they did. So some would come in there and make me laugh to see if I could laugh, or some would come in there and take me outside to see if I still wanted to go outside. Now that I recovered, I do feel like there's some things that I can't do that I could do before. But it's nothing too hard to learn at the end.
So I think this all started Thursday evening. There was a burger grilling event at my dorm building. Ate there with a few buddies. There's only one road on campus. We're crossing it to go back to our dorm building, and speeding driver just zoomed out at the intersection that we were crossing and just hit me. I went to Ben Taub, the brain injury ICU. Kept me motivated was I needed to get back to school, and I did all this to get into Rice. I'm not just gonna let it drop here. Don't stop now.
Positive patient outcomes are what we're all striving for. Having the tools to help people in their most vulnerable times, and working for a system that's consistently trying to make the processes better so that we can have the most amount of positive patient outcomes.
I'd heard about LBJ, that was honestly the best place for traumas. LBJ Trauma is awesome. I'm forever grateful for that team.
Today I'm back to full-time student, taking 16 credit hours, and then been back in the DJ booth since last semester.
I've become more empathetic to people, and one of the things that I've gained some empathy for is for people like Fran who suffer from their loved ones having a tragedy. And I've thought that they need to be told that they can step up and save the day. But I wrote a book in honor of this idea. The book is called Happier Than Ever, and it's the truth. I am happier than ever.
Once I had a head injury, I did think my music career was over. I never thought I would speak again the way I do today. Yeah, and thank all the surgeons who performed a magnificent surgery on me.
My patients have really taught me about resiliency because, again, trauma is sudden and unexpected, and we do have to be ready 24 hours a day, 7 days a week, 365 days a year. Watching them fight through what happened to them, and then watching them leave the hospital and seeing them continue on with their lives, that's what really motivates me.
The most rewarding thing is when you can say, especially with the trauma patient, my team worked together. We were really collaborative. We were fast, efficient. We did everything we could have done, and that's what's rewarding.
To have played a part in somebody being able to get back to their life is just, it's an honor.